Hello, welcome to our webinar, Provider Connect Australia. Welcome everybody. Say hi to me in the chat. Let me know that you are here. I can see a couple of people have joined. I'll give you all a moment. Let me know where you're listening in from. Hi, Veronique. Thank you. Excellent. All right, I'll give everyone a couple of breaths and we'll get started. Yeah, if you can, let me know if you can type in to the chat. Let me know where you are dialing in from and whether you're in general practice, allied health, non-GP specialists, where you are dialing in from today. Okay, what I'm going to do is I'll get started. This session is being recorded, and so welcome to our webinar on Provider Connect Australia. We acknowledge the traditional owners of country throughout Australia and their continuing connection to land, sea and community. We pay our respects to Aboriginal elders past, present and emerging. I would like to acknowledge the Gadigal people of the Eora Nation, this land that I'm presenting from today, this place known as Sydney. So hello to everybody in Queensland and beyond where you may be listening from. If you have not met me before, my name is Katrina Otto. My business is Train IT Medical. There's a spiel about me today. I mean, I guess the most important thing you need to know about me is, yes, I have been working in health for 30 years, many years as a practice manager, and I'm in practices across Australia all the time, helping with whatever the next improvement is that will make life easier for everybody in that practice and help you deliver the wonderful healthcare that you do deliver for your people. So a lot of people may have met me in the context of I'm a medical software trainer, so training, Practisoft medical director, best practice. I was also a My Health Record trainer, introducing My Health Record to the country. So I am very familiar with leading big change, so change transformation, and I'm going to share tips with you today. And I am passionate about making life easier for all the practice staff out there. So today we're going to be talking about a new feature which is designed to make your life easier. It's called Provider Connect Australia, PCA, and we'll talk about what the features are, the why, the benefits, how you would search and update information within it, and just leave you hopefully with okay, what's our plan in relation to this, to incorporating use of it, and could it make our life easier? So you will receive this recording, all the slides, all the resources, and not only that, but I'm going to leave you in the very wonderful hands of your host today, which is Country to Coast Queensland. So thank you to Country to Coast Queensland Primary Health Network for the wonderful work you do supporting practices, and I know you are ready and waiting to help everybody listening to take that next step after today and connect to the PCA. The purpose, what is it? It's free. I have a sister who is a clinician in the US who is always amazed when I'm introducing things like this, like My Health Record, and it's like free. It's by the Australian Digital Health Agency. Its purpose is to better connect us all together. So all of us providing healthcare, our business partners, think how many there are. Service Australia, the secure messaging providers. I won't go down that path yet, but there's a lot of ongoing updates that we need to do in a practice for these business partners that we connect with, right? So a foundation of a better connected healthcare system, the dream goal is to have a healthcare system where we can all interact and communicate effectively, that there is information available as we need it at the point of care. And it's accurate and up to date, timely. So our business partners can include National Health Services Directory, of course, which is the directory how we let people know that, yes, we're doing vaccines, and yes, we have this these providers and these services, how we let others know that we have a healthcare business. And online booking systems as well, and funders, if you think of not only Medicare, private health insurers, like workplace and accident insurers. Yes, your primary health network need to know which doctors you have working at your practice, which allied health professionals, who is providing what service, have that up-to-date information so they can better direct people to your service. And secure messaging and prescription exchanges. So I'm going to stop there for 1 second, only because I literally just finished doing a whole webinar on secure messaging. It is frightening me, the number of privacy breaches and hacking, the risk at the moment with not using secure methods of delivery in our practices. So one of the challenges we have with secure messaging, I always say, you know, so I live in the real world. So one of the challenges we have is, of course, our doctors come and go, you know, new staff come and go. So keeping these directories up to date. And if you think in a general practice setting, which I think, you know, I can see that there are some people I recognize today from general practice. In a general practice setting, you have registrars starting, stopping, lots of staff coming and going. So being able to have that information, how do I connect with that healthcare provider for prescription, for secure messaging, we need this up to date. And currently we're doing it 25 times and sometimes not doing it. Similarly with our diagnostic services, our receiving, sending results, and of course the public and private hospitals. So we need to keep our information available to our business partners, and it needs to be up to date. So rather than doing it 500 times, the goal of the PCA is we do it once, and then that will be pushed out by us, our choice, to our business partners. Now, I live in the real world, so not everyone's connected, obviously, it's brand new. It is a long game. We are a marathon in health when it comes to digital health. We're used to that. We don't live in a perfect world. We make the best of what we have, right? So right now, my question to you is this going to be an easier way? Could it help you avoid having incomplete and out-of-date information? There being errors on forms, barriers to uptaking new programs. And even, you know, the other thing I heard about this is, you know, common thing I hear is I didn't know about that. I wasn't made aware of that. So could it even be something like a new grant or a new initiative? How do people see you? How do they know you're there? Even I was talking about urgent care, had a practice who had a emergency care trained nurse practitioner and doctor, and were wanting to do like the after hours urgent care services. How do people know that you're doing that? Rather than having to add it 10 times, you can add it to PCA. So it does hamper our ability to be efficient. And the other benefits I would talk about is that reduction in duplication. So I have a question. I'm just going to check that. Thank you. Just saying hello. Thank you. I'm looking at the question, so please feel free to write something in there. If I don't know the answer to something, I certainly know the people to direct you to, and we'll do that. So the goal, reducing duplication, streamlining notification, making sure that information is up to date. and reducing the time. So if you are a practice manager like me attending today, updating something once, pushing it out to everyone else, very appealing. Do a lot of paperwork. Now, synchronizing validated information. Okay, now remember when we got PRODA, and I smile because I'm very used to leading change. You know, I introduced PRODA, I introduced My Health Record, I introduced eScripts, I introduced secure messaging. I think I still would have been introducing telehealth if it hadn't been for COVID. So change is like, you know, we're evidence-based scientists. We sort of go, where's the benefit? Where's the risk? Where's the evidence that it's going to be a benefit? So synchronizing validated information and establishing unique identifiers. So once we started to go down that path as a country of digital health, it is when we got unique identifiers. So our health provider identifier organization, our HPIO, for the practice or business. And then we got our health provider identifiers individual for all our AHPRA registered clinicians. And then our individual health identifiers for us as people, as patients. So this is establishing our unique identifier in order to connect in this digital health interoperable world. Okay, so with that comes, that's the tricky bit in getting connected. So if you are already using My Health Record, you would be familiar with this. If you are already using PRODA, you would know that that was a bit to set up, right? If you have connected to the National Cancer Screening Directory, is just one example. You know, we're accessing the most sensitive of patients' information. So we need to be able to prove who we are. So no, like anything, there is that setup process with this as well. But we'll end up with a single source of truth about our services and people that provide them. So how does it work? So learn how to search and update information. Okay, so here we have all of our different healthcare provider organizations, Provider Connect Australia, and our business partner as examples. As I mentioned before, is going to be a verification process with our organization, our practitioner, and that's already how we work, the HI service and AHPRA, Medicare, etc. So business partners at the moment, there are 35 business partners at the moment connected. So that's just going to grow. And these are some of them that are already connected here, such as the National Health Services Directory and eHealth New South Wales, the primary health networks, etc. And from an allied health perspective, it is the Podiatry Association who is first over the line. So obviously over time, this is just going to grow to other providers seeing the benefit, getting connected. But, you know, we don't force anybody to do anything in Australia. I'm laughing again because I have a sister who's a clinician in the US. She's always like, that's free in Australia. And it's like, yeah, no one has to do it. You know, these are all choices that we have. But when it comes to Provider Connect, you will go to the portal. It is an initiative of the Australian Digital Health Agency to help us update business information in a single source, so that we have that more accurate information available. So you go to the Provider Connect Australia portal and you log in. Now, I just wanted to say your primary health network, the wonderful Country to Coast, is here to support you with this after the webinar today, should you need help. But what you'll find, now, let me know in the chat, do you have yes or no? Or you can just put your little thumbs up. Do you have a PRODA account already? Okay. As I said, leading change, it's just normal. We resist change. It's human. Nobody wanted to use PRODA. I was like, no, I don't think I will. I'll just keep using the CD in my practice. No. Of course, Proda is our online digital access to a whole lot of services. Well, now, yes, yes. Thank you. We had no choice, right? We ended up with no choice. We need Proda. It's now helpful because we don't just access HPOS, Health Provider Online Services, which lets us look up things like has a patient had a care plan elsewhere. But we're now able to access a lot of online services through Proda. This is another one. Okay, so if you already have a Proda account, this is going to be a lot easier for you. So, yeah, you just need Proda and your ABN. Okay, and then you link. So this is a step-by-step process with a step-by-step wizard. You log in using Proda accounts, you register your healthcare organization, import the health identifier information, okay, add any locations that you have, add healthcare services that you provide, your practitioners, and then you hit publish. Okay, so I've got some screenshots to show you because I know it's difficult, you know, when you're in a training session and you're looking at, you know, not doing it. We're not doing it. We haven't got a test, that a test environment for me. So an organization is only required to register once. An agreement must be signed between the authority. So in your practice, just like you would have found with Proda, and it's probably got you guys listening in today, you need to have an authorized person. So an agreement must be signed and authority documents uploaded. And the helper wizard prompts you with this, okay, which is kind of nice. It's not where I'm up to. It's all very nice when things work well, though, isn't it? Now, so you enter your contact details, okay, add your organization, okay, add your organization. Now, the participation agreement and authority documents, again, as I said, this is probably going to be you. You might be the authorized person. Your director will sign a stat deck. So you choose who will sign the agreement, what evidence documents will be uploaded. Okay, you need your ABN, your legal name, nothing hard about that. Okay, just showing what it looks like. You upload it, download it, sign it, upload it. And it will tell you if it's worked correctly. Participation agreement, the stat deck from the director, okay, e-sign, okay, and you can copy that password. Again, like I said before, this is not dissimilar to what we've done with, or even, you know, the B2B set up in your software. So hopefully this won't be too onerous to set it up. And then once you have done that, that's when you're going to add your locations and your services and your practitioners and publish. Okay, so register and then you do the rest. And when it comes to adding your locations, that's obviously places where all your locations that you might provide. So, well, these are beautiful places where you all live, Montville and Malini and Richie-Dore and Mooloolaba. Love. So and just assume that you've got practices in multiple locations. If not, it's going to be just a little bit easier for you to set up. So location types, your physical address, obviously, unless you join only virtual care or you have outreach or a mobile setup. So you add those locations and then you choose which one is it. Again, don't think you're going to find this too hard. So 2 ways to add your organization's healthcare services. Okay, import them or add them. So if you've already done all this in the NHSD, just import them. It's going to be a lot quicker. You've already done it. And again, you see that how we're moving towards, let's just do things once. So adding healthcare services describe the specific services provided. So are you doing, do you have allied health professionals? And then what about languages? What about eligibilities to come to your practice, appointments and referrals, operating hours, etc. So you add those in here. This is the section where you're going to add your healthcare service details. And you manage the publication of that to others. Or you can manually add them, as we said. There's a picture. So, yeah, we can use the NHSD identifier. So adding your practitioners, they can be imported from AHPRA. So they're linked to one or more of your healthcare services. So that's not uncommon, is it? You might have in your practice, you might often offer skin cancer care, and then not all of your doctors would be part of that. Million examples we can come up with. Languages spoken, fabulous. And then your identifiers. So as I said before, your health provider identifier individual. So this is what is your unique identifier that you take with you wherever you go, and also your Medicare provider number if you're a billing practitioner. So you add your organization's practitioners to PCA and you publish. Retrieve it from AHPRA. There we go, it's an example. And that's what it would look like. I've got my practitioners. And you publish. So you update it every time a new practitioner joins or leaves. The details change, the location changes, you start to offer new services. Maybe you're doing flu vaccines, and maybe you're doing an extra clinic. New partner services require information about your organization. So this is becoming, the goal of this is it's one place to update this, and more partners will connect because it's a national service. Okay, publish. How to update? Okay, you log in, and then, yeah, you can change that information. You can add a location, add a healthcare service, add a practitioner. Plus, minus. Now, I don't have any questions in the chat, and I've got a few minutes left, so please feel free to type anything in there. But I just thought just in case I didn't have any questions, here's some I prepared earlier. Can multiple locations be entered? Yes, they can, and they should. Okay, so how does PROTA and PCA work together? Because remember, the goal is not to duplicate things again. We don't want more of the same. We've got to have a PROTA account. This is going to enable us to update information in PCA. And yes, it will push out to not just PROTA, but all the other services that we're connected to. Who can sign the agreement? You will confirm in your practice who's going to be the authorized person and sign the authority documents. Is there an easy way to import my organization's data? So that would be the healthcare identifiers information from HPOS. Import your list of services from Health Direct, even if you're updating them in Health Direct at the moment, or the National Health Services Directory, which I think a lot of us do now, or even the Australian Business Registry. So that's, again, that extra little bit of validation process. A question I get as the best practice and medical director trainer myself, I get all the time, is this integrated? That's always what everybody wants to know, because it's like, I won't have to go outside my software. So again, it's not integrated within the software, and realistically, it'll be a while. They are investigating it, but I don't really think it needs to be right now. Yes, you add your doctors and your hours into there. So I see that benefit of doing that and down the track. But right now, even if we could just have the PCA to update who are the doctors working in our practice, what days, what times, then that's going to stop having to not have that information available or having to update it at other places. So from this, what is your plan in relation to this? I am hoping it might be to access some of these links and resources. Yes, Bridget, there will be absolutely a recording, and thank you for your understanding about the time. I apologize. There is absolutely, this is recorded. Not only are these slides available, but I have kind of linked the key information to go to next. You are welcome to contact me with questions, but you actually have a dedicated, look how many contacts you have. We have a dedicated email address and phone number for your country to coast who are ready to help you with this. I'll just go back a step because I also want to show you this. So this is a really, really good checklist, good place to start. There's so much information. Just remember, Veronique, your plan is to, thank you for sharing, participating. It's always nice to have in the chat. My advice as somebody who has led a lot of these changes over the years and works in practices, it's easier to keep up than catch up. Just as you do this, just assess the benefits in it, the risks in it. To me, what are we doing now? Look at the controls that you have, discuss it as a team, and then go, okay, what's our next step? But as I said, we are having to update our information on a lot of different places at the moment. If this can make your life easier, it's going to be worth it, right? And I started off, Bridget, saying, you know, when it comes to secure messaging, and I know you have medical objects, which is great, but if you think about your doctors who are joining your practice, how many places you have to add that, and then how out of date that can get. So the idea is that you have the PCA, you update that, and then you decide who you push that out to from a business partner perspective. Single place to update your business information. Now, right now, you know, let's be realistic. Not everyone's connected. We've got 35 and one allied health association. But we've got the big ones, and once it starts to grow and be used, others will quickly come on board. Now, these are great links. This Provider Connect Australia website, I'm going to click on that for a moment. This is a fabulous website. So yeah, should I become a business partner? Register. It just steps you through it. This is a great video. Just looks like 1 minute. Watch that with your team. New users, existing users. It's just basically has everything that you might need to know. And I don't say that often about websites. I don't say that's a great website for it. So there's the links. There's your contact for help from the Australian Digital Health Agency, your primary health network. And I am Katrina Otto. You are always welcome to reach out to me if I can help in any way. I'm here for you as well. So thank you, everybody, for sharing your valuable time. I know how busy you are in practices, and I thank you for sharing your time with me and for the wonderful care that you provide. And I look forward to, connecting with you again soon. Thank you. Have a good afternoon.